floor muscles are an important group of muscles located at the base of our core. They sit within the bony pelvis, the word pelvis itself meaning bowl. These pelvic floor muscles fill the base of this bowl and extend like a hammock from the pubic bone at the front, underneath to the tailbone at the back, and stretching to either side, attaching to our sit bones. These pelvic floor muscles play an important role in many functions, including support of the bladder and bowel, and in females, the uterus. They help control the bladder and the bowel, assisting us to hold on when we need to, allowing us to let go when it's convenient. They also play an important role in sexual function. There are a number of factors over the course of one's life that might either cause or impose a risk in terms of weakening or causing dysfunction in these pelvic floor muscles. These include pregnancy, going through or having been through menopause, gynecology surgery, for example a hysterectomy, surgery involving the prostate, and for athletes who may have undergone high impact exercise, including gymnastics or trampolining. Other risk factors may include a history of back pain, trauma to the pelvis, whether that be through a fall or radiation therapy, constipation, meaning frequent straining to empty the bowel, being overweight, and heavy lifting, either through your job or perhaps in a gym environment. It is so important to keep these pelvic floor muscles functioning well across the course of your entire life. These pelvic floor muscles are so important in maintaining bladder and bowel control, and therefore allowing you to continue exercising without fear of leakage, let you keep socialising and getting out and about without worrying where the next toilet is, and keeping you independent and home for as long as possible. Barely a day goes by in my day-to-day clinical practice where I'm not asked by a patient a question along the lines of, "Am I too old for this? Isn't it too late for me to make these muscles stronger?" The answer to this question is no. You're never too old to invest in strengthening and improving the function of these pelvic floor muscles. By now I'm hoping I've got you all on board and convinced that it's worth spending a little bit of your time every day investing in practicing these pelvic floor muscle exercises. As we've just discussed, they help with both bladder and bowel support, uterine support for the females. They help to control bladder and bowel and are an important component of your sexual function. When we discuss doing these pelvic floor muscle exercises, there are a few considerations. Firstly, correct technique. Secondly, some signs that you may not be doing the correct exercise and therefore potentially doing more harm than good. And thirdly, how many of these exercises you should be trying to practice in order to see some results. When it comes to correct technique, we discussed earlier the location of these muscles within your pelvis. If we look back at our model again, we know that these muscles encapsulate the bladder tube, also known as the urethra, the vaginal opening in women, and the back passage, or the opening from the bowel. When we try to engage these muscles with correct technique, it's important that we're considering where these muscles are and what we're trying to achieve with them. So we can think about or imagine trying to stop the flow of urine. We could also alternatively think about holding onto some wind. So I'd encourage you now, sitting or standing wherever you may be, to think about where these passageways fall and to try and squeeze and tighten around these passageways as though you're holding onto urine or trying to stop wind. Now you may also feel, when you're squeezing these muscles, a small lift inside. We know that these muscles also lift and support the bladder and the bowel and the uterus in the female. And so you may feel a small lifting motion up and away from your underwear or perhaps the chair that you're sitting on. So let's try together, and I want you to try and squeeze and imagine holding the wind, stopping the flow in urine, squeezing up, lifting up and holding. Let's try for 1, 2 and 3. Now release and let that go. And it's important that with every squeeze and lift that we also feel a release and a let go, and that we have some time in between before we start to squeeze the muscle for the next contraction. I'll talk a little more in a moment about how many repetitions and how many times a day, but I would also like to bring to your attention some of the signs that might indicate that you're not perhaps using the right muscles or isolating the pelvic floor muscles in the best possible way. We know, as I said, that these muscles are very much isolated around those openings to the bladder, the bowel, and the vaginal opening also. So if we're seeing signs from the outside that you're trying to exercise these muscles, it may well be an indication that you're doing the incorrect technique or using muscles that you need not be wasting energy and time on. So for example, if we should see you moving up and down in the chair, squeezing your buttock muscles, if we should see the tummy muscles pulling in and out, or breath holding, or even the legs squeezing together, they are all signs that we're using muscles other than these pelvic floor muscles. So it should be from the outside almost invisible, an activation internally that you can feel but no one else can see. Now coming back to the question as to how many contractions should I be doing, how long should I be holding each contraction for, and how many times a day should I be doing these exercises. There is no one-size-fits-all approach. However, we can give some general guidance beyond which, if you have any concerns about your technique or whether your program may need to be individualised for you, I'd highly encourage you talking to your GP or seeking a pelvic health physiotherapist in your area to assess and individualise a program for you. To start with, we can consider doing just a short contraction, becoming aware of where these muscles are and ensuring we're spending some time between each contraction, releasing and letting go. So an example may well be that you start holding for a count of 3 seconds and resting for at least 6. The goal overall is to achieve some fatigue or some tiredness in those muscles, and we usually aim for around about 10 repetitions to achieve this. Let's practice a few together now. You can perform these exercises in any position. Most people will find it easier to perform either lying down or sitting to begin with, and then progressing to more upright positions like standing as you get better at the exercises. We also know that if you're having a particular problem when it comes to bladder or bowel control, that we can learn to use these muscles as part of a task. For example, a common problem is leaking with coughing, sneezing, laughing. So if you can feel a cough or a sneeze coming on, it is worth starting to try and practice contracting these muscles just ahead of the cough or the sneeze in order to close off the pipe to that bladder and prevent the leakage associated with that cough. Let's go back to practicing a set together now, and I want you, as I said, to find a comfortable position, one in which you feel that you are most aware of what's happening in these pelvic floor muscles. And we're going to practice to start with for a count of 3, holding on and then resting for 6. Let's start together. I'll use my hands as an additional cue, remembering from the outside it should be invisible. So we're going to squeeze and lift inside like we're stopping the flow of urine or stopping wind, holding for 1, 2 and 3 and releasing for 1, 2, 3, 4, 5 and 6. And again, squeeze and lift, hold for 1, 2, 3 and rest for 1, 2, 3, 4, 5, 6. Squeeze and lift, 1, 2, 3 and rest, 1, 2, 3, 4, 5, 6. Squeeze and lift, 1, 2, 3 and rest, 1, 2, 3, 4, 5, 6. Squeeze and lift, 1, 2, 3 and rest, 1, 2, 3, 4, 5, 6. Squeeze and lift, 1, 2, 3 and rest, 1, 2, 3, 4, 5, 6. Squeeze and lift, 1, 2, 3 and rest, 1, 2, 3, 4, 5, 6. Squeeze and lift, 1, 2, 3 and rest, 1, 2, 3, 4, 5, 6, squeeze and lift, 1, 2, 3, and rest, 1, 2, 3, 4, 5, 6. Last one, squeeze and lift, 1, 2, 3, and rest. So there you go, you've all attempted a contraction and a set of pelvic floor exercises. That's one round, and if we're really trying to work this muscle hard and see gains, we're trying to aim to do around 3 of those sets per day. It's a really good idea to try and attach it to something that you do on a regular basis to enable you to remember to do the exercises. That might be, for example, whilst waiting for the kettle to boil for your morning cup of tea. It might be whilst you're sitting at lunch table having just finished your lunch, or perhaps in an ad break when you're watching your favourite evening show. I hope you're now feeling much more informed about what these pelvic floor muscles are, where they are, how they work, and that I've convinced you it's worth taking a little time out of every day to invest in making them stronger and functioning well to ensure good bladder and bowel health, sexual function for many years ahead. If you do have any concerns regarding your current bladder or bowel function, I'd highly suggest that you go and speak to your local healthcare provider or ring the CFA National hotline to seek help to have an individualised assessment and management plan for your condition. And that's all for me. Thanks for tuning in and learning all about the pelvic floor muscles, where they are, how they work, and I wish you all the best investing in a very important part of your body for many years to come.